Our study that we recently completed is called Ripple, and it was a study that we developed over the past few years with colleagues in primary care, Alberta Health Services, Alberta Health, Public Health Agency of Canada, and our plan was to develop an online or digital intervention to help parents prevent childhood obesity. The Ripple study is really for moms and dads of kids, kids of any weight, any age. So our idea was to have something that parents could refer to when they come to a clinic, a primary care clinic. And they could be there for any sort of appointment with their pediatrician. And our idea was to capitalize, utilize that time well when families are waiting. Sometimes, there can be a 10 or 15 minute period of time where families are waiting for their appointment with their pediatrician. So we thought, here's a great opportunity to have an interaction with families and, in a way, kind of nudge them towards some topics that we think are timely and important for families in Alberta, and that's healthy lifestyles. So the intervention itself is about asking mums and dads questions about their children's physical activity and their children's dietary habits. A couple of key questions that just get them thinking, and we know for some families it can be an aha moment.
What my family learned from this was they're getting old enough that soon they're going to need to be making choices outside of the home. Right now I can make those choices, and so my goal, kind of starting last year and keeping to build, is that more that they learn about their nutrition, that when they're faced with the choices, they'll hopefully make the right ones, because long term that's where it's going to end up. So, right. And I think too they've found kind of the excitement of doing the exercise, and we found kind of some creative ways of adding that into our routines, and I think they've kind of also understood that there's ups and downs to it. We kind of check in with ourselves every month. I'm like, okay, we lost a little bit of focus that month, life was a little bit crazy, let's refocus, it's my idea. So they're more participatory in it.
We created Ripple with parents in mind. So we knew that they were going to be the end user, and we made it friendly, and the colors were very aesthetically pleasing and inviting. I think based on actually a study prior to our clinical trial in which we refined Ripple using focus groups, that really helped for us to pinpoint elements such as, oh, this needs to be changed or tailored, and this is actually really good, so let's enhance that a little bit more.
The driver for us in terms of the benefits are really about improving care for kids and families, both in preventing and managing obesity. So that's the main focus of the work that we do. A lot of the studies are very practical, they're pragmatic. They are designed to help health professionals do a better job in their clinical practice. We know that a lot of health professionals, whether it's physicians, nurses, or dietitians, a lot of them don't get training in weight management or obesity along the formal pathway. So our job, I think the job that our research group has taken on, is to try to develop tools and resources and test them, develop them, test them, and then disseminate them. It's got to strike a chord with people. I mean, there's certainly, our study was a good example of one that was fairly quick. It wasn't a big time investment. We caught them at that moment in time when they were waiting. So it was strategic for us to do that. So we're mindful of the time and commitments and other obligations families have, because we've been doing this for 15 years or so now. So we know that the more things you add on, the more difficult it can be for people to participate.
It really is a worthwhile thing, as well as helping the research move forward. It also gives you information yourself back. So you learn a little bit about yourself, you learn a little bit about the topic that's going on. And so I think both sides gain from it, and that long term it will also help move research and health things forward. So I think they're very important to support when you can.
The good part about our research is that I can explain it to my mom or my grandma or my great aunt and say, this is the type of studies that I do, and this is the research we're doing, and they get it. That's a nice thing to be able to communicate to people who are not in a research field. I know that's not always the case, but that's something that's always been important for me, is to be able to articulate it in a way that's meaningful for people.